back in my pro soccer days, like everybody was popping Advils and other kind of ibuprofens if they had an injury or they wanted to compete even in spite of having something that was not right with them. And yeah, I think, you know, that's probably one of the reasons why so many athletes, in conjunction with the fact that they just kill their bodies for decades, cannot last past 30 to 35 years in most cases. I mean, it's just, I don't know many athletes that are at the top of their game at 35. It's like, and they look like they're 50 by that point. Their body is just wrecked. So, and I'm sure you've seen a lot with, you know, with your experience with, you know, with the military and other things as well. So, yeah. So, considering that, you know, traditional medications are probably not the best thing to be relying on, what are some natural ways that we can kind of cool the inflammation and subside some of that pain so that our body can just function normally?
Good question. There's a number of different things that can be done. And so a lot of people kind of will gravitate to what can I take? If I can't take pain medication, what can I take? So I'll go through a few of those first. One is omega-3. In all the science and all the research about autoimmune and inflammatory processes, one of the most effective ways of actually treating is omega-3, but the dose has to be meaningful. So you know, there's this analogy I like to use. Imagine yourself trying to spit on a forest fire to put it out. That's what most people do when they take supplements, right, to try to treat a chronic inflammatory issue. For example, with omega-3, you've got to get anywhere from 6 to 15 grams a day.
That's a lot more than the bottle would suggest, right?
Yeah, the bottle's usually going to say take 1 or 2 pills a day, and the one pill may be 1 gram, but then it also depends on the concentration of EPA and DHA, which are the 2 active ingredients in omega-3 that actually block and combat inflammation. So we're actually looking, when I say 6 to 15 grams, I'm talking about 6 to 15 grams of concentrated fish oil, where 1 pill or 1 gram would contain about 700 milligrams of EPA and about 300 milligrams of DHA. So that's, you know, that's a lot more than what you're buying if you're going to Costco or Sam's to pick up, you know, the fish oil at the local store.
And there's really no side effects with, I mean, other than people who are on blood thinning medication, there's really no contraindications to omega-3s as far as I know, right?
No. Well, so the only thing you want to be worried about, let's say you're going to go in for an operation. You wouldn't want to take a high doses of omega-3 before the operation because they don't want you to bleed out as much, and it thins your blood, so it'll make you bleed, as you mentioned, the blood thinners. But what'll happen to most people if their dose of omega-3 gets too high is their nose will actually start to bleed. So they'll have kind of a spontaneous nosebleed, and that's their upper limit. You really, at that point, you're taking too much fish oil.